Look, the Pilbara Aboriginal Health Alliance is a partnership between the Aboriginal medical services in the Pilbara. It's really about having a peak body that can represent their interests, advocate on their behalf. We're all about trying to secure additional funding to improve health outcomes for Aboriginal people in the Pilbara. It's a challenging place to work. The remoteness of the Western Desert communities, the distances involved, logistics of getting vaccines out there, making sure that clinics were staffed, big challenges.
We look after the communities in the city of Karratha. So we've got Roban, Wickham, Karratha, Point Sampson, Dampier, plus we've got a few little communities outside of Roban, 5 Mile, Mingalathandu, Chitatha, Wurawana.
So Wirrakamaya Health Service is an Aboriginal community controlled health service that provides primary health care to the Port Hedland community, and we do outreach to Warralong community. We also have social and emotional wellbeing, and we're a registered training organisation, and we have a chronic disease team attached to our clinic.
We provide comprehensive primary health care to the Matu of the desert and the Nyapali of Newman now. The area which we provide services really is like twice the size of Tasmania if you want to compare it that way. So from Newman and all the way until almost the Northern Territory border. The area where they call home, it's very remote, and the high cost of doing anything out there just makes everything difficult.
We were extremely worried about the impact that COVID-19 would have on what was a very vulnerable population. A lot of older people, a lot of people with serious chronic illness, a lot of people with the sort of respiratory illnesses and diabetes that can create very high risk.
We had a few priorities. The main ones were making sure that patients were still able to access the same level of care that they could during pre-pandemic times. So trying to keep as many services open as possible. Safety was another huge concern for us. So safety for clients attending the service, but also making sure that the workplace was a safe environment for staff that was still going to be working during this difficult time.
In our pandemic plan, when COVID hit the Pilbara and Headland in particular, we split our workforce, where we had one team working from home and the other team here. That actually worked very well for us, because even though a greater chunk of our workforce, about almost close to 80%, got either affected or infected, we were able to carry on with the care of the patients.
We had a COVID preparedness plan. Basically what we did is screened everyone before coming into the clinic. We were rat testing ourselves as well as our clients if they were symptomatic, and really just pushing the vaccination.
It took 3 months for us to get PPE up here, especially out to the remote clinics. That was really difficult. So Newman sort of took on the role of the hub, and everything was brought in here. We ordered as much as we could, and if the remotes ran out, we had an emergency stock for them.
When the pandemic hit, we established a RATS testing clinic marquee that was put outside our clinic.
Any patient that was coming through was screened before they come in, so that if anyone tested positive, then they were asked to go back home. We got their details. Then we straight hooked them onto telehealth. The transport officers will then take the medication to their doorstep and hand that over to them.
The care for the people I used to transport bus. When I know somebody's on lockdown, I'll just go and see the pharmacy, and then they prepared the Vicks, cough mixture and mask, gloves, hand sanitizer, so it was great. Because some people can't go out to the shop, so get the little pack what they need, and then I knock on their door and then I run back to the bus.
So we were approached by the community when COVID occurred across the towns around Karratha, especially around Roban, where people couldn't get out to get any shopping or any essential items. Galbagoo has a supermarket, and we formed a partnership with the supermarket to help provide food and essential items. Once we went into lockdown, we worked with the Department of Communities on who they needed to help every day. We also had our own telephone service that people could contact. So when they did, we took down all their details and the things that they needed, and then the Galbagoo staff worked with the Yandina staff to pack those food and essential items and have them delivered. We did that on a daily basis for a couple of months, and we helped around 600 people over that time.
We made a lot of plans to make sure that we could continue to provide care for patients once we went into lockdown. So the face-to-face site was kept for people who thought they were sick with COVID or having respiratory illness, and the telehealth hub was to continue with that ongoing chronic disease management. We had a triage system in place as well, so that patients who could be managed by a nurse rather than a doctor would first be put through to a nurse, and that helped us to deal with the heavy workload, because a lot of people were frightened during that time and a lot of people were turning to their GPs for support during that time.
You know, they had everything under control. They had to support the people, and the people needed someone to tell them what it was all about and what you're up against, because you got children and elders in your house.
We had doctors out in the front talking to people in full PPE and sharing information about the vaccine. We even had doctors going to people's houses to chat to them, especially if it was older patients who were worried about leaving the house, just to give them some peace of mind. So there was a lot of effort and a lot of legwork that was put in just to keep our community safe.
The plan around COVID outbreak was more around education first, when it first came out, to educate a lot of the community members and then get people to come forward and have their vaccines.
We didn't really know how we were going to get hit, so we really were working hard to try and convince people that the vaccine was really the best thing we could do. So before we could actually give any vaccines, we had to deal with the misinformation.
People had a fear of getting the vaccine, not because they didn't want to protect themselves, it was because they didn't know what was in the vaccine.
Madu were very susceptible to a lot of social media talking about the reasons why you shouldn't get vaccinated.
I found there was a lot of problems that people didn't understand about COVID-19 vaccinations. There was no breakdown into language.
A lot of times the government information that was coming out was being shared with the public and us at the same time. It didn't give medical facilities an opportunity to prepare our own material to really target our patients who we know best. But our doctors did a really, really good job at speaking to people one-on-one, going out into the community. A lot of them shared pictures of themselves getting the vaccine. We scrambled to get information recorded in language so that a lot of the elders could understand exactly what was being done and what the vaccine meant for them and for the community. And a lot of it came down to us as a team banding together to make sure that the information was accurate and that people in the community were keeping themselves safe.
I tell them, don't be ashamed, be game, because you can't travel on a plane, you can't travel on a bus, and you can't walk into a shop. Then they started coming in one by one, but it was great. Then I said, thank you, I'm very proud of you. You know, give them a nice little feedback like that and then make them feel good. You can save somebody, you're right, you're happy.
We've got a vaccination outreach program going. It enabled an Aboriginal doctor to go out to community with some health workers and deliver vaccination programs, explain to people in a culturally appropriate way what it was all about, put down some of the resistance.
So we've done a lot of outreach works to immediate surrounding remote communities. Luckily we have an outreach bus which we thought was very convenient because it's in the open, people can see it. We're trying our best also to promote it through our platforms like social media platform, Facebook. That has helped us a lot to drive people to the bus as well.
And it was a difficult message to put out to the community that first you need one vaccine dose, now you need a second booster, now you need a third booster, and now we're at the point where we're encouraging people to have a fourth winter booster too. And that's been a real challenge to overcome. The specific things that we did was just to be persistent with our messaging, creating easy access, and also always talking about the evidence base for using the vaccinations.
I think the other challenges were really around getting vaccines out to places that were very, very remote. You know, we're talking 500,000 square kilometres of land. You couldn't transport them by vehicle across dirt roads because they went all milky and you couldn't use them. So they're just some of the things.
When we first started to get the vaccines out to the remote clinics, RFDS would deliver them. Then RFDS didn't have the capacity to deliver for us, so then we had to start hiring planes, delivering the vaccines out there. We were sitting once out on the airstrip at Coonawarra. It was 60 degrees inside the cockpit. We couldn't get the plane started because it was so hot, the fuel in the plane was just vaporising. We got to the point where we couldn't even sweat anymore, it was just so hot. But we kept the vaccines between 2 and 8, and that was the main thing. Yeah, so that was really quite difficult.
Often what we found was that the impediment to vaccination was logistical. If we offered a lift now to go and get vaccinated, people would take that up. By early 2021, we were getting very high levels of people looking to be vaccinated.
One of the logistical difficulties we had is nobody had anticipated how quickly the numbers would grow in this small area. And we found very quickly that we didn't have a sufficient supply of antivirals, and we had to collaborate with the Commonwealth, with WA Country Health, to try to secure larger supplies of Paxlovid. And there was a lag of a few days before we were able to secure that, which was probably one of the early obstacles that we came across.
The way we prepared to deliver care to patients once we went into lockdown was to have parts of the community which was for isolation. The problem was that people would use those places at night time, but then they would mix in with family through the day. Although we had the best laid plans, it was very difficult to get the message across as to how those plans were supposed to work in the community.
We had a lot of focus on COVID. We still had people out there needing chronic disease support. We still had patients, needing to come in for various reasons in the clinic, and so we had to manage that as well.
It was very difficult because there was a massive demand for medical attention. So we did experience a lot of fatigue. There was a lot of staff burnout. There was a toll taken on them.
When I look at the amount of work we did in that time, it was really phenomenal. Long hours, 7 days a week.
I think it's been a good experience, and I think when it comes to do you sit down and do a bit more of a bigger report, I think they need to talk to the people on the ground first. I think it can be more tailored, to a more culturally appropriate way of how these policies are going to be implemented in the future.
If there's a future pandemic, a remote community needs to be treated as a household rather than as a suburb. People who are infected are going to move around, and in any case, by the time you've identified a single infection, 2 days later, the whole community has been infected. At that stage, there's a great deal of logistical support and care that needs to be provided to households.
Look, we learnt an enormous amount in that period of 4 or 5 months, but I'm really, really proud that the AMS stood up, and we didn't have one death in communities, and we had very few serious illnesses. But that's an amazing effort when you consider the challenges that we faced.
The collaboration I saw, in responding to the pandemic, probably I've never seen it in my working care. That was really good because you could get a phone, you've got an issue, you'd be assisted right away. And so that was really good.
Something that really impressed me strongly was the way that government, corporate and non-government organisations came together in a really collaborative, cooperative way, and something that would be good to take away from COVID and to apply to other areas of social difficulty.
I was most impressed by how willing the healthcare professionals in our organisation were to just do whatever was asked of them. Nobody complained, nobody said, oh no, I can't work in a face-to-face situation. It really was inspiring to see how working in healthcare truly is a vocation for the team at Mount Curra, and it was wonderful.
The way that they took on the extra duties of, dealing with COVID, they really did get in and get their hands dirty with making sure that our community was protected, our staff was protected. We really did go over and beyond.
Everybody, in the end, had the one desire, which was to keep the community safe above all else, and that prevailed, day in, day out.
We had staff in the clinic who were in full PPE. We also had staff that were getting sick with COVID. but we still, managed to provide a health service to the community.
I think that the way that we handled it was the best that we could, and it was very successful. We have no cross-contamination within the clinic. We just made sure that we were safe. So we haven't had to stop operations at all through the entire pandemic.
If we all could turn back, I reckon we all would say the same thing, to support my people and support others out there.